Billions are spent policing and punishing those who use or sell many types of drugs. So why is drugs use still on the rise? And what should we do about it? This is Roundtable with me, David Foster. It is a constant battle for governments across the world. Some countries adopting a zero-tolerance attitude towards drugs use, others more lenient. The hardline approach has been successful, some say, in some places, but not others. And there are those who believe that decriminalising is a better way forward.
They destroy lives, families, and communities. Governments have spent years and billions of dollars fighting illegal drug use. But over the past decade, illicit drug use around the world has risen by a third. Do we need to find a better way to control illegal drug use? Japan has one of the toughest drug laws in the world. From cannabis to cocaine to heroin, long jail sentences are the status quo. That's translated into very low levels of drug use. And there's long been opposition to drugs in a society where cultural conformity is valued. Sweden has some of the lowest drug users in Europe. Strict laws and prevention led the UN to praise its drug control policies. But with drug-related deaths at 4 times the European average, its zero-tolerance stance has come under scrutiny. As has the tough approach in the US. Nearly half of federal prisoners are locked up for drug-related offences. But as incarceration rates soar, addiction levels remain the same.
What we've learned is that the war on drugs has increased drug usage. It's filled our jails, it's cost millions of dollars, and it's fueled organised crime worldwide.
In 2001, Portugal decriminalised the use of all drugs, a move that some said would increase the problem. But 17 years later, many say the opposite is true. Addiction levels are slightly down, HIV infection rates have been drastically reduced, and Portugal now has the second lowest overdose rate in Europe. So far, the severe consequences that opponents predicted haven't materialised, but there are still concerns. Years of recession, a spike in unemployment, and cuts to rehabilitation clinics could put that progress at risk. Managing illicit drugs is still a major problem for governments to deal with, and a policy that works in one country may not work in another. From manufacturer to end user, drug abuse continues to affect every aspect of society.
Well, joining me to talk about this at the Roundtable today, Niamh Eastwood, who's the Executive Director of the charity Release and believes that tough sanctions have no impact on the level of drugs use. To my right, George McBride, who's the Crime and Justice Policy Director at Volteface, a think tank that looks at alternatives to current drugs policies. On my left, Professor Niamh McKeganey, Director of the Centre for Drug Misuse Research, who is against decriminalisation. And next to him is community pharmacist Thorrun Govind, who believes that drugs policies have failed, but that decriminalisation is not the answer. Thank you all very much indeed for coming on Roundtable. Let me ask one of you two here. Can you think of any incidents where drugs use is not as insidious as many people believe it is?
I think the use of cannabis is a clear example of a situation that is very different from where most people would be thinking of when they're thinking about drug use. Most cannabis users, both in the UK and abroad, aren't otherwise unlawful citizens. It doesn't tend, most people who use it don't end up abusing it. Most people who use it responsibly. It doesn't tend to lead to acquisitive crime or violence or any of these other things that people might think are issues around drug use.
But when it comes to those drugs which are more headline drugs, such as cocaine, heroin, methamphetamine, etc., etc.
I mean, sometimes what we get is, when we talk about drugs, what most people tend to go to is problematic use. And in fact, when we look at the statistics across all drugs, about 90% of people use drugs, all of the substances, in a non-problematic way. They are not addicted to them. And for the 10% who are addicted, really what the reason for that is complex. It's not because of the drugs themselves, but it's because of the experiences that they've had. Many of them have been traumatized. They've suffered physical abuse or sexual abuse as children. They have mental health problems.
By the drugs themselves.
No, that's not the case. I mean, at my organisation, Release, we work directly with people who use drugs problematically, so people who have a history of heroin and crack cocaine use. And generally, people take these drugs. And remember, heroin is a part of the opiate family. It's a pain-relieving substance. And many people, most people who use problematically, do so to take away the pain that they've suffered. And many have mental health problems. And again, this is around relieving pain. I think the problem is that we've had decades of demonizing people who use drugs. That's largely as a result of prohibition and the legal framework that we have that criminalize these people who, I would argue, should deserve our care and respect and not be demonized and criminalized.
I think Niamh here would probably also agree that they deserve care, they deserve respect, but you also think they should be punished, is that right?
Well, I think that it's very difficult to see how society can conceivably address its drug problem if there is not some element of sanction against use. I think if there was no sanction against use, the level of consumption would go up. I mean, I don't dispute that some people's lives are not harmed by drugs use or drugs misuse, but I think it's completely misleading to present cannabis, LSD, heroin as drugs which in themselves do not cause harm. I mean, I've interviewed hundreds of individuals whose lives are profoundly affected, whose families are destroyed, whose own sense of self and identity is destroyed, not because of our laws, but because of the impact of an addictive substance which has completely replaced the direction of their lives. And in circumstances of marginal, excluded people who latch onto drug abuse, that can further end up excluding those individuals. So I think it's quite wrong to present the harms of drug use as somehow to do with criminality or our laws. These are dangerous substances, which is why that we attempt to regulate.
But if we look at the market that we have at the minute, prohibition has been in place for about 100 years, the international legal framework for the last 50 years. And what we've seen is drug use increase incrementally almost every year since statistics began. So the UNODC estimates, and that's the UN Office on Drugs and Crime, who are responsible for this policy, estimate that approximately 250 million people globally used drugs last year. That's up 100 million in the last 10 years. Cocaine production is up 25%. Opium production is up. Purity of drugs in the UK are at the highest they have ever been.
But
we have not. So the policy
bring in
fails.
Thorrun here, because your experience is somebody who works in the pharmaceutical business or as a pharmacist in Bolton. Have things changed recently?
Well, I mean, this is a public health issue when we look at it with regards to drugs, because on a day-to-day basis, I'm seeing people come in. Now, there's some users who I'm seeing have been on methadone for absolutely years.
Which is a heroin substitute.
Which is a heroin substitute, which is, so they are then go into treatment, they get assessed, they then come and see me in the pharmacy, where some of them I have to supervise them watching it, and that can be for a variety of reasons. It can be because if we don't supervise it, they may end up taking that drug elsewhere and selling it on the street, or it might be just because it's safer for them to come and have it watch them take it. But it is a public health issue, and my concern with at the moment with any change to any drug policy is actually the public funding. Public health cuts are into place. Community pharmacies have gone under public health cuts recently, and so these people, the most vulnerable people in society, which not all drug users are, but a vast majority are going to suffer.
You can have control, which I think everybody here probably agrees there should be some degree of control, but you can have control shortly without decriminalisation.
But
You can. I think one of the problems we've got here, though, is firstly, I'd just like to take a point that Niamh said, which is that we control these substances because they're harmful. I don't think that's true. I think there are historical reasons why substances have been banned, and they were largely to do with, you know, racist concerns, industrial concerns. There are all sorts of historical reasons why certain drugs have been banned, and they are not because they're dangerous. That's just simply not the situation. That's a post-fact rationalisation of our laws. But I'd like to say that dealing with this issue in the round is where we get so much confusion, because some people are talking about vulnerable people in Bolton, other people are thinking about middle-aged men sat at home enjoying cannabis, watching a film. Other people are thinking about people who've been seriously sexually abused as children using heroin on our streets. And these are all very different situations with very different responses.
Where do you come at it?
Well, I mean, the first question is, do you want to criminalise people simply because they put a substance in their body? And we know, as I've said, you know, that the aim of prohibition is to suppress or eliminate drug use. That's its aim, and it's failed miserably in its aim. But not only has it done that...
I don't agree, Niamh. I think
Neil,
you know,
just,
you can say that there are more people using illegal... You can say there are more people using illegal drugs, and that's unarguable. That's clearly the case. But that in itself is not a failure of the drug laws. There are more murders or more burglaries. We don't change our laws in relation to these other areas just because there are more
murder and burglary too.
But what I'm saying is the increasing prevalence of the activity is not in itself a reason to say the laws have failed and that we should
But the point I was going to make was that not only has it failed in its primary aim of eliminating drug use, it also carries with it very significant attendant harms, both domestically and globally. So if we look at example at the UNODC again, in 2008 they produced a report that talked about the unintended consequences of prohibition. And they said in that report that the market is worth 500 billion every year, that this is a financial incentive to organised crime, that it fuels violence. And we just have to look at Mexico. Mexico has 100,000 people dead since 2006, 250,000 people displaced, 27,000 people disappeared in the last since 2006. And last year, the Institute of Strategic Studies said that Mexico was the second most violent armed conflict area in the world after Syria, and that's as a result of drug policy.
Why not?
Here we have the highest rates of drug-related deaths.
Why not, to either one of you two, why not control it in such a way that it is a taxable source?
Like
you then
alcohol,
use
you
the
would say
money.
then.
You then use
Like
the money to
alcohol.
treat the people that you're talking about,
Yeah.
and to also treat the victims of drugs, crime, etc.
Well, to point out, alcohol, we tax alcohol.
And cigarettes.
And cigarettes, and nobody would argue that they're not harmful. No one would argue that a cigarette's not harmful, even if it's just one. But we would then say as well, it's the laws that have been put in place, like you were saying, with regards to racism and other issues as to why these laws have come into place. But I'm now seeing the after effects of these laws. I'm seeing the impact of noxious substances on people's bodies. And we do needle exchange as well from community pharmacies. That means that people, if they are using drugs, can come in for non-judgmental advice about injecting, and they can be given clean needles. So I'm of the position that if people are going to do this, they need to be given the safe route to be able to practice this.
Niamh, do you want to comment on the Portugal experiment, which by and large I think people would agree has been relatively successful?
Yes, I think in terms of its impact on Portugal, the policy of semi-decriminalisation there seems to have had some beneficial impacts, largely because it has steered people who are in difficult circumstances associated with their drug use into treatment, and that is unquestionably a positive development. I think where we should be cautious, though, is the latching on to another country's policies and saying we should replicate that here. And if you say, for example, what impact has recreational cannabis licensing had in parts of the United States? In parts of the United States, there are now more so-called medical marijuana outlets than there are Starbucks cafes, Walmarts and 7-Elevens combined. Now, the reason for that isn't because people are uniquely unwell in parts of the United States. It's because this rapidly gets spotted as an area for big business.
I think that's
and big business comes in advertises and promotes the consumption of these substances. And that is, in a sense, the danger that we face. The only other thing I would like to say is the notion that these substances are not harmful is totally belied by the fact that in Scotland we've released drug death statistics that show nearly half of all our addict deaths are linked to methadone, which is a prescribed drug. These drugs are in themselves dangerous.
George, make your point. Then we'll get on to prescribed drugs.
It's just a twofold point, but I'll be brief. I think me and Niamh are agreeing on one thing, and I think that's different communities need to design their own response to drug problems that they face. I think one of the biggest problems that we ever had in the world was setting out to have a war on drugs orchestrated by the UN, a global response to an issue that varies hugely in terms of the regions and the areas. But what Niamh said was that there are areas in the US where there are now more medical dispensaries for cannabis than there are Starbucks and McDonald's put together. That's not quite true. He's talking, I think, about Colorado, where there are more dispensaries than there are McDonald's and Starbucks put together. But they, as a community, have decided that it is acceptable to sell cannabis for recreational purposes, that it's a perfectly legitimate business and enterprise, and if people want to sell a relatively harmless plant to each other that they enjoy, that there are risks involved in using, but that they all enjoy, they as a community will benefit from it. They've seen improved funding for schools, education and awareness treatment, huge boon to their industry and their economy.
I'm going to stop you there because I want to bring Thorrun in on prescription drugs.
Well,
and alcohol. You mentioned alcohol.
Yeah.
But things that are available.
Yeah, I mean, there's no such thing as a safe drug. Let's put that out there straight away and agree on that. You know, if you opened up a prescription drug in the patient information leaflet in there, you probably wouldn't take your medication if you read it all properly. And I end up with patients giving me a call who have read it really thoroughly.
But is there a major problem with people abusing the use of prescription drugs now, a growing problem?
There is a growing problem with prescription drugs. At the moment, we're seeing things like pregabalin more prevalent on the streets. People break into pharmacies for these things. Let's not forget that. If we were going to have some sort of dispensary on the high street that you're suggesting, are we going to have more thefts, you know, of people wanting drugs?
I think this kind of demonstrates the complexity of the situation, and trying to reduce this down to a half-an-hour conversation makes it difficult. Yeah. But for example, the medical cannabis, there's evidence that's come out of the US, and it's been well evidenced now, that shows we know in the US there is an opioid crisis, that there is an opioid death crisis. I mean, their rates are 187 per million of the population.
Where did that come from? You know where that came from?
Prescribing, having prescribing. But just let me finish my point. In those states that have medical marijuana, they have our medical cannabis, there is less hospital admissions for opioid overdoses and less opioid overdose deaths. So it's the complexity of this. It's how different drugs can affect in different ways. And I agree completely that the pharmaceutical companies have been hugely influential on the negative impacts. I'm going to go around the table on this one
because we're talking about specifically the UK here, and we're trying to get some kind of conclusion in a very short period of time. George, I want everybody to go. Where should we go now? Because whatever's happening right now probably isn't working, so where should we go?
I think we need to move with public opinion. Vast majority of people in the UK support medical access to cannabis. That should be the very first step.
But if I want it recreationally as opposed to medically?
I think we should do that too. I think people tend to do medical first because they're the people in most need, and I have friends and colleagues who suffer from medical conditions and can't access their medicine, and they are the priority. They should get access to what they need. And then, as soon as we can set that up, we should set up a recreational market too, because equally I have friends who use it perfectly responsibly and shouldn't be forced into committing a crime.
And it doesn't lead to other drug use?
No, not at all. There is a higher rate of drug use in later life of people who use cannabis earlier, but it's more pronounced for people who use tobacco or alcohol earlier, and it's far more to do with someone's life circumstances as a teenager than it is to do with any of their drug habits.
If your friends are having to actually use illegal substances for their treatment because they're in pain, then that concerns me as a healthcare professional, because that means that we're not doing enough then for those people. And I think that again goes back to the public health cuts. I mean, we spend for drug misuse with the NHS, we're spending 488 million. That's a lot of money, which should be used absolutely for people in the most need, but we need to make sure that treatments are accessible to the most amount of people.
But whatever we're doing right now, it's not working.
Well, I think the last thing that we should do is initiate any policies which run a real risk of increasing our drug consumption above what it is presently. Because it's all, George is in a state of denial, quite frankly. He wants drugs to be freely, widely available to anyone who chooses to use them, as if they're harmless. We already have heard from Thorrun, drugs are not harmless.
Because he refers to recreational drugs.
Yes,
It's a total
Do you
straw
believe there's no
man.
such thing?
One
I'm
in
talking about cannabis.
1 in 6 young people using cannabis will become addicted to the drug. Now, that is a massive problem. I don't want policies implemented that result in more drug use. I want policies instituted that result in fewer drugs being consumed.
This is
because
the issue.
People's lives are not enhanced by this, they're actually diminished by this.
This is the issue. It conflates the issue of use and misuse. Allowing there to be more people having access to properly regulated cannabis does not mean that we're going to have more cannabis misuse.
But has it not been shown that the use of cannabis can encourage people, if not directly lead them to, but encourage them to want to try other
No, that's
other
not
drugs,
true.
such
I mean,
as
the
cocaine,
cannabis
which is
the cannabis gateway theory has been completely shut down.
No,
there is some.
that's
there
a
is.
gross
There is some.
oversimplification.
There is some.
It is not the case.
Neil, there is some.
Niamh,
Neil,
it is
Neil?
not the case that
Neil?
it is so comprehensively derided.
No,
like
no, no.
that.
It has been
there is
accepted.
no
NIDA have
question.
said that there is no
Niamh,
cannabis.
The evidence shows there is no necessary progression
That's-
from cannabis
If you
onto
let me
other
finish
drugs.
my point
However,
on the evidence.
almost all
the
users of
evidence,
these harder drugs have prior use of cannabis.
Oh, and they've drank milk before. That's a ridiculous argument.
No,
the
no,
point is,
Niamh, it's a
the
fact of
evidence
life.
that's showing us around gateways.
There
and
are
actually,
4
I
on the table, you guys.
I wanted just
Yeah.
to make a broader point about the UK drug policy, but just to say the evidence around gateway is where we have young people exposed to a market where someone is dealing a range of substances. That's where the exposure is.
You know, the
Let me
difficulty
make a
here-
point
Yeah, please, go on.
about the regulation of this system. At the moment, we have prescription-only medicines which have to be prescribed by a doctor to be able to access. And as I've said earlier, there are people who will then try and access those illicitly, whether that be on the black market. eBay, you regularly see some medications pop up on eBay and quickly shut down. So I think people are trying to sort of take that market of going and selling these drugs more openly than perhaps they used to. And it's a bit easier, you know, if you pop onto social media, it's probably easier to access these drugs.
So many points that we can follow up on here. But I think as we come towards the end of the programme, unfortunately, I want to ask you whether you think we will change, because it's not a vote winner, is it?
Can I just, so you asked about the UK situation. So the Home Office has produced 2 reports. There's a 2014 report that looked at different countries around the world and compared their legal systems for drugs. And the Home Office found that tough sanctions had no impact on prevalence. The most recent report is an evaluation of the drug strategy, and that's an evaluation of the 2010 strategy, which identified that 1.6 billion is spent on law enforcement. So when you say about diverting money to the NHS, I'd like to see that money diverted to that area. But they find that in terms of law enforcement, it had no impact on the trade. So the government's research says this is a failed policy. So as a result of that, I think that we need to get to a point that politicians
I know, but we're talking about the reality, the realpolitik here. Is it going to change?
Well, I understand your concern with realpolitik, and that's why I said as a first step medical cannabis access, because it's something that has broad support across the country. We've done polling on it. It's very well supported. These are the issues we need to bring the public along. I completely agree with Niamh's position, but unfortunately I don't think that enough of my fellow UK citizens do agree. I think with time they'll learn that that's the right approach, because we've both studied it.
I agree with that, George. I think ultimately it's about how you sell it.
It's not going to change.
It's not a vote winner, and neither of the 2 main parties are supportive of a weakening of our drug laws. And actually, I think that's the most comforting aspect of this debate. We are not going to in the UK, we are not going to go down the road.
So it's another one of those, if you excuse the terminology here, where it can be pushed into the long grass. Because
the drug issue is not in the long grass. The drug use is ruining communities across our land.
I understand that, but changing the law is not going to...
Well, I think politicians actually are often quite spineless in tackling the drugs issue. The rhetoric is often quite tough, but the policies are pretty flimsy.
I'm going to ask Thorrun before you
go ahead.
we have time to say whether you think it's going to change.
I don't think it's going to change at the moment, because there's been a lot of cuts, and I think the cuts are going to continue. And unfortunately, I think the government's got other priorities at the moment, including Brexit. So this is another thing that's going to get swept under the carpet.
Your main concerns are...
My main concern is the treatment available, the money for that treatment available, and to make sure that we continue to be able to provide support for those who are most vulnerable. Because if you've got a lot of money and you can afford to go and purchase these drugs, which can be quite high cost, you're probably going to be able to access the treatment if you become addicted to them. Whereas those who are suffering and having the sort of drugs which aren't even pure, which are available on the black market, that's who I need to focus on.
We're running out of time, but I'm asking for quick bullet points towards the end. Sorry.
So you mean, from our point of view at Release, you mean we provide services and see the harms caused by drug policy directly. And I'm not of the view that this is an issue that politicians won't grapple with. Things can change quickly. I think the fact that we have the highest rate of drug-related deaths on record, that 1 in 3 deaths in Europe, drug-related deaths, occur in the UK, that more people are dying of drug overdoses than traffic fatalities. These are all reasons. This is a crisis that we have, and crisis often leads to reform. And I think there is an opening of conversation with the Labour Party and with other parties. The Lib Dems are on board with this, the Green Party. I mean, so I think there will be political...
Harmful from your point of view and harmful from your point of view as well. We have reached some kind of consensus.
But I don't want drugs regulated.
I understand. Niamh, thank you very much.
Thank
you all
Thank you.
for coming on this. It's brief, but important discussion. Thank you.
Thank you.
We agree, I think, that when drugs threaten people's health, their families, their communities, there is clearly a problem. But should those who take the drugs, this is what we've been talking about, be considered criminals, or should they be given medical help? You've been watching Roundtable with me, David Foster. From me and the rest of the team, thanks for watching. See you next time. Bye-bye.